Hello, my name is Dr. Nikki Minor and I'm a consultant rheumatologist here at North Bristol Trust. Over the next few minutes I'm just going to explain how we think you could get the most out of any rheumatology appointment. This goes for any member of staff in our department, whether you're seeing a nurse, a physio or a doctor, and I hope it's helpful for you. The first thing I'd like to talk about is it's important for you to plan what you want to talk about in the appointment. This is called your agenda, and to help you decide what you want to talk about, we've developed an agenda setting tool which is shown here. We developed this with some other rheumatology patients, and it's got some suggestions of things that you might like to discuss with the clinician you're seeing, plus some space for you to put in any other problems you might have. If there's nothing in particular you want to talk about, that's fine, but it's important for you to ask about your problem early on in the consultation, otherwise people might run out of time to consider your problem. There is a slightly different version for young adults up to the age of 25 years, shown here. Secondly, I'd like to talk about when you have to make a treatment decision, because from time to time you may have to decide whether to change the amount of treatment you're on, or whether you'd like a referral to see another clinician, for example a physiotherapist or perhaps even a surgeon. It's important for you to have all the right information to make the correct decision for you. There's a national decision-making tool called Ask 3 Questions. It's also available on our website. And the 3 questions are: what are my options? What are the possible benefits and risks of these options? And what help do I need to make these decisions? So you will discuss the treatment option in the clinic, and that you may have enough information at the time to make the decision, or you may be given leaflets to take away and read and have a think, and you may be asked to call us back later with your decision. It's important not to feel pressurised to have some treatment, and you can always say no thank you. Finally, I'd like to talk about lifestyle matters, because there's a lot of things that patients can do to help themselves and to help their arthritis symptoms. We all know that smoking is bad for us, but not many people realise that it actually makes arthritis worse, and it also fights against the arthritis treatments that we have. This means that people who continue to smoke have more pain and swelling in their joints, and also have less good response to the medication that we've got. So stopping smoking is very important for everyone. However, there are also other lifestyle factors which can affect arthritis symptoms. These include stress, sleep, diet and movement. Most of us can think of a way that we would like to improve our lifestyle, whether that be losing weight, doing some more exercise, or making some changes to our diet. The good news is that making any of these changes will help your arthritis symptoms, and if you're not sure where to start, just ask any member of the team and we can help you. So in summary, please remember to plan your appointment, what you want to get out of it, just as you would going to the GP. Bring a list of problems if you want to, or use the agenda setting tool which is available on the website. Don't feel pressured into making any treatment decisions. Make sure you've got all the information you want using the Ask 3 questions. Please bring along a current list of your medication in case things have changed since your last appointment. And remember that lots of lifestyle changes can also help with your arthritis symptoms. Thank you for listening and good luck.